All right, guys, we're going to do neuro assessment. There is a PowerPoint posted on Canvas. You can print that off, review the anatomy and physiology on your own. There are 10 NCLEX style questions to be turned in by 11/17. And go ahead and listen to this explain everything for the neuro assessment. Okay, we're in chapter 56. We're on page 1343 and 44. There's a nice chart. Just talks about age-related findings. You guys will be glad to know that you've already started to lose neurons because most of you are young adults. And as we lose neurons and as we have a decreased cerebral blood flow, there's certain things that suffer, such as retrieval of information from our memory, and decreased readiness to learn and a greater distractibility. We also have slowed nerve conduction, meaning that we can have a slower reaction time, and we also have decreased reflexes. We also, as we age and central nervous system changes, we cannot respond as easily to multiple stimuli, and this includes the ability to adapt quickly to environmental changes, such as in temperature. We also know that the elderly have a slower response to balance changes, just meaning, for instance, from a sitting to a standing position. They suffer more so from orthostatic hypotension. They can also have issues with balance in general and experience vertigo. One thing with neuro is you're going to want to make sure that the individual you're talking to is actually a good historian and a reliable historian. And then take your examination of their past medical history as far as neuro from there. So you want to look for any type of neurological disorder, seizures, fainting, dizziness, headaches, trauma, tremors, any type of chronic diseases such as multiple sclerosis, myasthenia gravis, Lou Gehrig's disease, Parkinson's. Also, one thing that's not written on here too is look for any kind of birth injuries, particularly if they led to cerebral palsy. You also want to look at a family history because, as we'll find out, there are a lot of neurological disorders, diseases that tend to be genetically linked. Good history of what are they taking? Are they taking their prescribed medicines for their neurological disorders or diseases as they should be? Make sure you're asking about any use of sedatives, tranquilizer, or opioids, any over-the-counter drugs, herbal, and complementary therapies. The functional health patterns is on page 1145. One thing it doesn't address is occupational hazards, and there are, as you guys know, a lot of occupational issues for the neurological system, such as back injuries and people who have repetitive motion injuries such as carpal tunnel, and then those who might be working in factories where they're at risk for head injuries, and those working in chemical plants that are at risk for chemical exposure. Also, you want to ask them about their use of alcohol and tobacco, but certainly any type of recreational drugs that might be altering their mental status. And then safety measures or safety practices. What do? Do they wear their seatbelt? Do they wear a helmet when they're riding their motorcycle or their bicycle? And then you guys can read through the rest of the health history on page 1345. As you can see, there are a lot of genetic considerations for neurological disorders. Page 1344 in your book just touches on them ever so briefly. It talks about Huntington's. It's genetically transmitted. That is the only way it's transmitted. Some of the other ones that have a tendency are Parkinson's, multiple sclerosis, epilepsy tends to run in families also, but the one that is clear genetics is your Huntington's disease. Other neurological diseases that have a genetic tendency, when you guys get into peds, you'll learn about Tay-Sachs disease, but also ALS, and Alzheimer's tends to have a genetic component.